important to focus on prevention, to understand what is happening in the body. A lot of diseases, lifestyle diseases, you must remember that hospitals and medical doctors, they are trained to treat. If you have the problem, they can use medication to help you to control, but many of them are not trained to help you to prevent, and all of us need to understand this. I know many of you all probably know people who are having problems with diabetes, hypertension, even cholesterol problems. Sometimes you must ask yourself this question. The people that you know that have this problem, they have been on medication maybe 5 years ago. Until today, they are still on medication, okay? And many of them, until their last day, they will still be on medication and they'll be taking more and more medication, okay? The reason is medications are designed to help to control the symptom, okay? They are basically not designed to help you to cure the disease. If you want to cure the disease, you must go back to your cellular level, to the cell level, and help the cell to become stable again. You must help the cell to become happy again. If the cell is happy, then you will start moving towards a healthier life.
今天我们其实看到很多的这种文明病其实都是因为生活形态所造成的。所以我要跟大家特别强调一点的就是现代的医学的目的其实主要都是通过药物来控制我们的这个生病的这些症状，他们并没有被教育怎么样从预防来减低这一些慢性病的发生。所以你可以看得到很多病人从他们第一天开始被发现有这种慢性病吃药，到最后一天他们去世之前，他们都是在吃药的所以我们一定要记得，如果你要帮助你自己的话，你一定要去到细胞跟组织的这个阶层去帮助你的细胞健康，你才能够真正的脱离这一些所谓的慢性疾病。
Don't misunderstand. Medication and drugs, they are very important to help an individual control the condition. So when somebody has a lifestyle disease, the medication and the drugs are meant to help them to control the symptom. Okay? But at the same time, they also must do something proactively in terms of lifestyle management to help the body to try to heal. Okay? So it's very important. Don't go and tell someone who's taking medication to stop taking medication. That is not the right way of doing it. Okay? Those who are on medication and treatment, the advice is now they need to help the body by controlling their lifestyle. And one component of lifestyle that is very, very important is basically focusing on nutrition.
好，所以大家不要误会因为这个药物在这个慢性疾病的角色扮演上还是非常重要的，因为它是很好来控制这些慢性疾病的这些症状的，所以千万不要去告诉你身边的那些有慢性病朋友，即刻停止他们的这些药物的服食，这是不对的而是要教他们改变他们的生活习惯，而其中一种很好的生活习惯就是要补充这个营养的补充品。
Okay, so let's look at some of the details in relation to diabetes. Now, diabetes has another name. Diabetes is known as the mother of all disease. Why we call diabetes the mother of all disease? Because when somebody becomes a diabetic, they will start having complications from head to toe. Everywhere will start having problems.
好，首先我们要来看糖尿病糖尿病有另外一个名字叫做万病之母所以如果你一旦得到糖尿病的话，你可以从头到脚趾都有很多糖尿病的并发症。
Okay, now a person has diabetes most commonly because of two reasons. And there's actually three types, but we'll talk about these two first. Okay, now type 1 diabetes is when the body cannot make insulin anymore. Too little or no insulin. This one normally happens sometimes young age, and this is a condition that is related to autoimmune disorder. Remember when we were looking at the immune system, when the immune system goes out of control, when the immune doesn't know what is good and what is bad, it will attack the pancreas. When it attacks the pancreas ability to produce insulin is now compromised. So the pancreas cannot produce enough insulin, or sometimes to a level where no insulin. Now people like this, okay, they have diabetic, but it is called diabetes type 1. This is not due to lifestyle, okay, but this is an autoimmune condition. For people like this, they will need insulin and injections for their entire life.
好，我们来看糖尿病的起因，基本上有2种。第一种我们叫一型糖尿病，一型糖尿病通常是发生的年纪都非常的轻，记得吗？我们在这个讲到免疫系统的时候提到这个原因，这个都是因为免疫系统失调所引起的。所以当你得到这种病的时候呢，你的胰脏没有办法产生或产生很少这个胰岛素，所以它基本上不是生活形态的，不是生活习惯所造成的。而是自体免疫系统所造成
的。The second type of diabetes, type 2 diabetes. Now this is because of mismanaged lifestyle. Okay, this is where chronic inflammation come in. Remember we talk about chronic inflammation, long-term inflammation. Okay, when the body is losing its ability to control blood sugar. Okay, and after some time, the blood sugar levels start to get higher and higher, where the person needs medication. Okay, in this condition, the body reaches a level where it cannot use the insulin that is made. This is a condition called insulin resistance. Now, 90% of diabetics is because of type 2 diabetes. 90%. This is the one that is caused by lifestyle mismanagement. 90% is here, 10% is type 1. So this is the bigger problem. Most people who are diabetic is because of type 2 diabetes.
好，第二种呢，就是所谓的2型糖尿病，90%的糖尿病病人都是属于这一型，所以这个是最大的问题。2型糖尿病的问题呢，就是因为他们的生活形态造成他们的身体没有办法很好的利用他们身体所产生的这个胰岛素，我们叫做胰岛素抵抗症啊。所以目前来说，全世界面对最大的问题，关于糖尿病的是属于这一种的。
You know, and remember I told you just now, somebody who's a diabetic, why is diabetes called the mother of all disease? If it is not properly managed, from head to toe, problems from the heart, kidney, the eye, you know, it also sexual problems, you know, damage of nerves, you know, damage of blood vessels, you know, everywhere in the body will start having complications because of diabetes.
所以糖尿病将会产生以下的这些各种不同的这些并发症，包括心脏病、肾脏病、眼科的疾病等等等等。
Okay, and some of the risk factors. Okay, now today I'm seeing this age becoming lower and lower. Okay, we do see individuals who are becoming diabetic at the age of 15 years old, 16 years old, and getting so common. 20, 30 years ago, if we find somebody who is 15 or 16 years old becoming a diabetic, we need to do a lot of investigation. Why? But today it's becoming more and more common. Because why? Mismanaged lifestyle. Look at the kind of food they're eating. The consumption of processed food is too high, and processed food is too high in sugar. Okay? And some of the other risk factors. Okay? Asians also have a higher risk, you know, of diabetes. The other problem is when you're overweight or obese. Okay? That's another risk factor also.
我们来看一下有哪一些风险因素哦。现在只要年龄超过35岁以上，其实罹患糖尿病的几率就越来越高了。然后尤其有一些人的那种饮食方面呢，都摄取了过量的这个糖啊，还有包括像一些高危险群，西班牙裔或是这个亚裔、南美洲、非洲的都有个问题，就是有一些人就是体重超胖，尤其是腹部的肌肉过高的情况底下，都容易罹患这个糖尿病。
Okay, and family. If you notice parents having it, okay, brothers or sisters with diabetes, your risk might also be high. Okay, sometimes a female that gives birth to a baby, and if the baby is more than 4 kilos at birth, we call it big baby. Okay, now there's a high chance that the mother, okay, might be also affected by diabetes. Maybe not at that time, but maybe later part in life. Gestational diabetes. Okay, gestational diabetes is a lady that becomes diabetic during pregnancy. Okay, sometimes, okay, it's only during pregnancy they are having problems with diabetes. After pregnancy, back to normal. But if they're having this problem, that means as they get older and older, the chances of becoming a diabetic is much higher. Okay, then somebody who has problems with blood pressure, high blood pressure, okay, and blood sugar problems are interrelated. High blood sugar can also trigger a problem to become a diabetic. Okay, higher risk factors, okay, and cholesterol. When we talk about diabetes, hypertension, and cholesterol problem, they are all abang adik. Sometimes if you get one, you will get the other two. So that is why you have to be very careful. If you can control not being a diabetic, make sure your blood pressure is normal, and make sure your cholesterol is normal, then the chance of getting a lifestyle disease related to the heart, kidney, liver, and all the other disease, okay, all the way to cancer, the risk is actually very low. So you must control, okay, not being a diabetic, not being a hypertensive, and having good balanced cholesterol. Very important.
好，我们来看还有哪一些风险。所以，如果你的父母当中或兄弟姐妹里面有糖尿病，你就很可能会比较高的几率会罹患上糖尿病。还有就是婴儿出生时候超过4，也就是你本身出生的时候超过4公斤啊，这种情况底下的话呢，这个婴儿本身以后罹患糖尿病，还有孕妇本身罹患糖尿病的几率都会增高，可能不是那个时候，而是过后。还有妊娠糖尿病，就是在怀孕的时候血糖特别的高，虽然怀孕之后恢复正常了，可是当就是很多年以后，可能进入中年、晚年有时候是相对比较容易得到这个糖尿病的。除此之外，你的糖耐量啊、空腹血糖啊，就是这种不平衡，还有就是高血压的情况你就更容易的，还有高胆固醇，还有其他血脂问题，也会让你容易患上这个糖尿病。记得，一旦你患上糖尿病之后呢，你就更加容易得到高血脂跟高血压。所以我们讲说这几个是好兄弟来的，通常都会连在一起。所以如果你不要得到慢性疾病的话，要确保的就是你没有糖尿病，你没有高胆固醇，你的血压正常，基本上你的身体的其他器官就会很好的受到保护，而不会变成最后有这些慢性病。
Okay, and these are some of the symptoms. How normally people know that they might be having diabetes. Okay, is generally they're not feeling too well. Okay, they might not. Okay, they feel that they're feeling a bit sickly, a bit weak, and all that, and they're always feeling tired. Okay, and they are passing more urine, especially at night. Sometimes they need to get up 2-3 times at night and go and pass urine. Okay, and they are always thirsty. These are some of the common symptoms that can indicate that a person might be a diabetic.
有什么症状呢？一般上来说，你一旦罹患糖尿病的话，第一个你会常常觉得不舒服，感觉疲倦，然后很多尿，尤其是晚上需要好几次起床来上小便，然后你很容易口渴。
But we must remember, many people might have symptoms, but there are some people that might not show any symptoms at all until one day they might just faint, okay, because of high blood sugar. So the only way to be sure is to actually do a test to see what is your blood sugar. It's not just about fasting. We also need to do what we call a little bit more advanced testing to see how sugar is being controlled in the body. This is very important. Don't take things for granted.
就算你没有以上的这些症状，不表示你不可能患上糖尿病。有一些人是突然有一天晕倒了之后，才发现自己的血糖超标很厉害所以最好的方式就是做定期的检查，不只是测所谓的饭后血糖，甚至是做比较就是详细一点的血糖的检查。
Okay. Now, some of the other symptoms are also sometimes when you get an infection, okay, you keep getting an infection again. That means recurring infections. Okay. You have an infection, you go and get it treated. Then after 2-3 weeks or 1-2 months later, you keep getting it again. Now that is another indication. Sometimes cuts and sores that is very slow to heal. This is also an indication that possible diabetic. Okay. Another very common symptom is numbness, tingling. We call it pins and needles. Okay, numbness. Okay, especially in the hand or in the legs, in the feet, near your toes, you feel that it's a bit numb. Now this is another indication of possible diabetic. Okay, and for males, okay, problems with erectile dysfunction. Okay, having problems of erection. Now this is another symptom of diabetes.
除此之外，还有哪一些症状呢？譬如说，经常性的感染伤口，还有就是擦伤了或淤伤了之后很难复原。还有另外一种情况就是你的手脚，就是你的神经末梢手脚常常会有刺痛或是麻痹的一个现象。而对于男性来说呢，就是很慢或是没办法勃起这样的一种情况，也可能是糖尿病的症状。
Okay, and so we talked about type 1. Type 1 is caused by autoimmune problem. The body's own immune system attacks the pancreas, and the pancreas cannot produce enough insulin or cannot produce insulin. This is 10% of cases of diabetes is caused by type 1 diabetes. Type 2 is lifestyle related. The body can produce insulin but the body cannot use the insulin that is produced properly. This is called insulin resistance. 90% of people out there who are diabetics are type 2 diabetes. And during pregnancy, sometimes some females might go through what we call gestational diabetes. Okay, but after delivering the baby, they might be back to normal. But this is a warning that later part in life, they might have problems with diabetes.
好，那所以基本上糖尿病分为3种，第一种就是所谓的1型糖尿病。1型糖尿病我们刚才讲的是免疫系统出了状况，大概占了10%。第二种2型糖尿病，主要就是因为我们的生活的形态的问题、生活习惯所造成的，这个大概占了90%。那第3种呢，就是所谓的妊娠糖尿病，妇女在怀孕的时候罹患上糖尿病，可能过后会复原，可是表示她在以后的日子里面罹患上糖尿病的几率就会增加了。
Okay, so if you look at this picture, when somebody is normal, this is normal process. Okay, what happens here is when you consume food, okay, and the food is digested, okay, and then the sugar, okay, starts getting into the bloodstream. This is the blood vessel, and you notice that the sugar is increasing in the bloodstream, and the pancreas produces insulin, okay, and this insulin is also in the bloodstream, and what happens? This glucose now go into the cells. They go into the cells, okay, and after some time, the sugar in the blood becomes lesser. Now this is normal. That means as the sugar is increasing in the bloodstream, the pancreas produces insulin. Insulin will allow the glucose to go into the cell. This is a normal process, okay?
好，我们来看整个的过程当我们的身体吃了食物下去了之后，经过我们的胃部，然后经过我们整个消化系统，这个血糖就进入我们的这个血液当中。同时间，我们的这个胰脏就开始产生胰岛素，也同时进入血液当中。这个胰岛素就会帮助这些血糖进入细胞当中。OK， 所以你可以看得到，血糖在这个血液当中的分量就开始降低了，这是一个正常的一个现象。
So when your pancreas can produce enough insulin, and the insulin can be used in the blood to help the glucose go into the cell, what happens is the glucose levels will be in balance in the blood. This is very important, So this is called a balanced healthy system.
所以一个正常的系统就是当 血糖升高的时候，胰岛素可以帮助这些血糖顺利的进入细胞当中，然后这个血糖在我们血里面就会降下来，然后达到一个平衡的一个阶段啊，这就是一个正常的身体运作的情况。
So this is normal. Now let's look at something that is abnormal. Okay. Now this is abnormal. Okay. Now this is when somebody becomes a diabetic. Okay. So the person eats food, the glucose goes into the blood. All these blue lines here is the glucose. Then the pancreas produces insulin. The green color is insulin. Now, what happens is the insulin is there, the glucose is there, but very little glucose go into the cell. Very little. Okay? Most of the glucose is still in the blood. So when a lot of glucose remains in the blood, this is an indication that the person is a diabetic. You know? Very little glucose is going into the cell. Most of the glucose is still in the bloodstream. So when we do a test, we notice that the glucose level, the sugar level in the blood is very high. Okay? It cannot go into a cell. So this is a condition called insulin resistance.
好，我们来看，如果你拥有2型糖尿病的话，当你的血糖进入你的血液当中的时候，胰脏产生胰岛素，同时进入血液当中。可是只有很少的血糖能够顺利的进入你的细胞当中，大部分的血糖还是留在你的血当中。所以这个时候，如果我们去测试你的血液的话呢，就会发现里面的血糖值非常的高。这个就是我们常常说的所谓的胰岛素抵抗症，就是这些血糖没办法顺利的进入细胞当中。
So in summary, okay, we look at this. Type 1 diabetes, okay, is when the body cannot make insulin, failure to produce insulin. Okay, insulin is needed to make sure that glucose can go into the cell. Okay, because our immune system has affected the pancreas, now there is no insulin or very little insulin in the body. Okay, so this is called type 1 diabetes. Type 2 diabetes is when the body can produce insulin, but now it is a condition called insulin resistant. Okay, so when you have a condition called insulin resistance, now the glucose cannot go into the cell because the cell now is resistant to insulin. So this is type 2. 90% of cases is type 2, 10% of cases is type 1.
好，我们来看一下1型糖尿病跟2型糖尿病。1型糖尿病的问题就是身体没有办法或是制造很少的胰岛素，所以造成这些葡萄糖不能够进入我们的细胞。而2型糖尿病的情况是身体能够产生胰岛素，可是胰岛素细胞却对这个胰岛素产生抵抗我们叫做就是胰岛素抵抗症。所以这种情况底下，最终血糖也不能够或是很少量的进入这个细胞当中，而90%就是属于这种2型糖尿病。
Okay, and gestational diabetes, this is one pregnancy one. Just now when we talk about it, okay, diabetes that happens during pregnancy, but as what I mentioned to you just now, the female must be careful because why the risk to develop type 2 diabetes, okay, is higher in later part of life, okay, and this is a warning by the body. You know, if the female has become a diabetic during pregnancy, the female must be very careful in lifestyle because there's a higher chance of becoming a diabetic later in life.
OK， 好，那所谓的妊娠糖尿病呢，就是糖尿病发生在一些妇女的怀孕后期阶段，但是这个也是对身体对这些妇女的一个警告，这表示以后在未来的日子里面，这些妇女患上2型糖尿病的几率就会比较高。
Okay, now when we look at a condition where somebody, how is a person diagnosed, okay, of being a diabetic, okay, and many people are very familiar with this. Today you can do a lot of this testing even at home, okay, you can get a glucometer and do what we call a finger prick test, okay, prick the finger, take a little bit of blood into the capillary sensor, and then you see a reading on your glucometer. Okay, now, so there's a couple of different tests that normally that is done. Okay, one is what we call the random plasma glucose test. Random means basically can be done at any time of the day. Okay, where if the levels are above 8 units, okay, then further investigation is required. But one of the more common ones done is basically fasting plasma glucose. Okay, fasting blood glucose, basically, okay, you fast overnight, morning, before you have your breakfast or any other drinks, you test your blood. And the levels must be below 5.6. If it is above 5.6, that means there's a chance that you might be a diabetic. Of course, there are also many other tests. Okay, and one of the other tests is a test called HbA1c, which is actually a much more accurate test because why? It will test the average of your blood sugar over 3 months. Okay, these are some of the ways testing is done in the clinic. Okay, and there are many other tests to confirm what are the levels of problems and all that. Okay.
好，我们来看，我们要怎样来测试我们是不是有糖尿病？除了我们自己观察身体有没有多尿，常常口渴，原因不明的体重减轻以外，很重要的就是我们要做我们可以做自我的检测。现在市面上很多那一种所谓的血糖测试剂，大家都可以容易的买到哈。那第一种呢就叫做随意空腹血糖，就是任何时候一天任何时候你测试你身体的血糖，它都不可以大过8.0。那如果是空腹血糖，就是你已经一整个晚上完全没有吃东西，在你早上醒来之后没有吃早餐以前呢，你做这个测试，如果它高过5.6的话，那你就要注意你自己的血糖是不是有可能患上了糖尿病。那另外一种呢，我们叫做 HbA1c， 我们叫做糖化血红素，这一种呢就是测试你的血液平均3个月的血糖，这是一种比较准确的测试糖尿病的一种测试，但是它必须是在专业的那种验血中心才能够做得到的。
Yeah, so there's a combination of symptoms when a medical doctor is doing investigation to confirm diabetes. The blood test results will tell a lot. Then some other symptoms, if you look at this, like polyuria, polydipsia. Okay, this is basically when you urine too many times of urination, especially at night. Very thirsty, polydipsia, very thirsty. Okay, and some people, when the diabetes become quite chronic, okay, quite bad, they start losing weight. So these are all the symptoms that is combined with blood test investigation to actually see what is the status and also to see what is the proper treatment.
所以另外的就是我们刚才讲的多尿啊，然后常常口渴啊，所以如果你有发现自己有不明原因的体重减轻的时候这个时候你就要特别注意了。
Okay, so when should somebody be tested for diabetes? Remember what I told you, it is no longer what it used to be like 20-30 years ago. Today we are finding youngsters, teenagers, 15, 16, 17 years old that are already becoming diabetic. Okay, so the earlier you can test, the better it is. Generally, I tell people that, okay, if you're already above 25, make sure you do a periodic test. Okay, because our lifestyle is such. Today we are eating too much of processed food. We don't have enough physical activity, so the risk is higher. Okay, the other good indication is people who are overweight and people who are obese. Now, being overweight and being obese puts your risk to diabetes, okay, higher. Okay, and it's a good time, to actually test. Okay, now some of there are also other risk factors and all that in combination, especially if the person has family history, okay, or what we call problems that are showing symptoms, common urination, and then very thirsty all the time and all this kind of things. So these are some of the indications that might tell that you might need a test.
那到底什么人应该做这个糖尿病的这个测试呢？现在的时代不再像20-30年前的那个时代，很多年纪很轻的人都有这方面的风险。 所以我建议基本上如果你在25岁以上，你就应该要时不时做一个这个血糖的检测。如果你是超重的话，身体的这个脂肪过量的话，更是强烈建议你要进行测试。还有一种情况就是你的家族史里面有人罹患糖尿病，或是你已经发现我们刚才所说的以上这些症状，多尿、口渴、体重不明原因的减轻，这样你就应该要做这些测试了。
Okay, so when you talk about treatment, now I believe that many of you all that have spoken to people who are diabetics, or even some of you all that might be suffering from diabetes, sometimes when you go and see a doctor, I believe that many doctors will tell you that there is no cure for diabetes. Once you become a diabetic, you will be a diabetic for life. Okay, now let me tell you, that is not true. Okay, the question of there is no cure for diabetes is no longer true, because there are many people who have become diabetic, and by making lifestyle changes, they have become healthy again. Okay, they have managed to beat the diabetes problem. Okay, but it requires a lot of discipline. It requires a lot of lifestyle management. Okay, so, and when I say lifestyle management, it requires discipline, and this is a very tough thing for people. I've seen many individuals, I've helped many individuals, from recovering from diabetes, but I noticed that those who recover are those individuals who are very committed and disciplined. They are able to follow a set of guidelines and make necessary changes. If a person is willing to make that changes and make the necessary lifestyle changes, then it's a very high chance that the person might be able to overcome the problem of diabetes.
所以今天我们想谈到这个糖尿病其实是不是没有办法治疗的呢？如果你去问到医生的时候，很多医生都会告诉你，糖尿病是没有办法治疗的。而在我的经验里面，糖尿病是可以逆转的，尤其最重要的就是那个人本身要有决心，要能够有纪律的去真的严格的去改变他的生活形态，而这种纪律是真正的可以逆转整个糖尿病的这个法则。
Okay, but we must understand the first objective when somebody is a diabetic is to make sure that their condition doesn't get worse. That is the first priority. Okay, because why? We want to prevent complications that can affect other problems such as the heart and the kidney. The heart and the kidney are the two most common systems that actually get affected when somebody is a diabetic. Okay, in fact, kidney failure, more than 60% of patients of kidney failure are those who are diabetics. The balance 30% are those who are having high blood pressure. So if you combine high blood pressure and diabetes, more than 90% of kidney failure patients already. So it's very, very important to control these conditions.
所以其实在整个的治疗过程中，很重要的就是要用西医的方式来控制整个糖尿病不再继续的恶化。因为一旦你让糖尿病继续恶化的话，会产生很多的并发症，譬如说像心脏病和肾衰竭，尤其是心脏这个肾衰竭，60%以上的这一些糖尿病病人，如果没有加以很好的控制的话，都会有这个肾受损的情况开始发生。
Okay, and it's very important. That's why if you look at the preventive steps, okay, people need to be educated. They must not be ignorant. So that's why I put this as the first step. The first step is you need to understand what is diabetes. Once you understand what is diabetes, then all the other countermeasure becomes easier. Okay. Of course, physical activity is another one. Okay. When you start increasing your physical activity, now you start teaching your body how to burn glucose more efficiently. So this is very, very important.
所以很重要的就是要有适当的这个教育，所有的糖尿病病人都要了解自己的情况，不要到最后的时候一切的问题发生都是因为无知还有个就是要有适当的这个锻炼，因为 唯有加强锻炼，你的身体才能够去燃烧这一些多余的这个血糖。
Okay, then we talk about the importance of nutrition. Okay, the kind of food to eat, how much to eat, what time to eat, the meal timing. Okay, what are the specific nutrients that can make the body handle sugar better? So there's a lot of things to learn about nutrition in terms of how to manage diabetes. Okay, and weight management. If you are overweight and you are obese, the chances of diabetes is higher. So one of the very important countermeasure is when somebody is having problem with diabetes, they must start losing weight to become back to their normal weight.
好，另外一个呢，就是你要学习怎么去补充营养，什么时候，然后什么营养你需要，什么时候你吃，然后你要吃的分量是多少，这个对于你调节你的血液中的血糖都是很重要的。然后另外一个呢，就是体重的管理啊，保持健康的体重对于2型糖尿病的管理是非常非常重要的，你绝对不能够超重跟吃肥。
Lifestyle management, okay, lifestyle management is about not just stress management, okay, learning how to manage your stress, okay. People who are stressful, hormone imbalance, when your hormone is imbalanced, the chances of diabetes is very high. I've seen people who are very stressful, they are not overweight, they look very healthy, but they are diabetic. The reason is because stress level too high. Chronic inflammation, okay. Then you talk about not getting enough good quality sleep. You talk about not enough exercise. All those is about lifestyle management. So lifestyle management is very important in preventing disease, not just diabetes, but all the lifestyle diseases. You know, you need to manage it properly with good lifestyle management. And the other thing that's also very important is for diabetics especially, okay, blood pressure must always be maintained below 130/80. Okay, now 140/90 is hypertension range. Okay, but for diabetic, they must control it below that 130/80 because why? Many diabetics will end up having high blood pressure if they don't control diabetes properly.
OK， 然后呢，另外一个就是你要懂得所谓的生活管理，学习减少生活的压力哈。我发现有很多人虽然他没有过度肥胖，可是因为他的生活非常非常的紧张，压力非常非常的大。别忘了，当你压力很大的时候，你就会产生所谓的慢性发炎然后睡眠不足啊等等等等的这些情况，都可能导致你糖尿病然后还有一个就是你一定要维持你的血压在130/80之间，尤其如果你是糖尿病病人的话，因为如果你一旦去到了140/90的话，对于一个糖尿病病人来说是很容易造成其他的并发症的。
Okay, and medication. Remember what I told you just now? If somebody already has a lifestyle disease, they will already be on medication that is prescribed by a medical doctor. Don't go and stop the medication. Okay, you need to combine that with lifestyle management. If the condition of the disease is getting better, okay, then the medication can be reduced. Okay, but don't immediately remove it. Okay, so for people who are type 1 diabetes, no choice. These are people that will be on insulin injection for their whole life because why? The body cannot produce insulin already. So whole life require insulin injection. Type 2 diabetes, there are medication, different types of medication, but it must be combined with physical activity and lifestyle management. Okay, you have to have lifestyle management together with medication to control it. Only then, you know, will you be able to actually bring it under control. If it is not brought under control, some people, they don't care, diabetes start getting worse and worse. Now this group of people also, after taking oral medication, first is the tablets, then eventually they'll be taking insulin injections already. You know, that is already a very what we call a very chronic state of diabetes already.
那我们讲要如何治疗糖尿病呢？我强烈建议你一定是要这个药物跟这个自然疗法一起并行的千万不要去叫这些病人 同时就是断掉他们的药物 ，OK。那对于1型糖尿病来说呢，很不幸的，他们终身都得注射这一个胰岛素，那个是没有办法的。对于2型糖尿病来说呢，除了这个药物的控制以外呢，他们一定要配合运动，还有所谓的这个膳食的这个整个计划，然后呢，过程当中这个药物的减少要视乎状况，如果说情况有所改善的话，药物就可以慢慢的减少然后再配合上运动的话，这个问题就会越来越改善。
Okay, so complications. Remember just now I told you one of the primary objective is to prevent the complications of diabetes. Okay, so what are the complications? You see here all the medical terms. Okay, retinopathy. Retinopathy means basically talking about problems with the eye. Some people who are diabetics can end up being blind because it affects their retina. Okay, nephropathy. Nephropathy basically talks about the kidneys. Okay, kidney failure. Nephrons, okay? Neuropathy, nerves. This is when they start losing the sensation of feeling, especially in the legs and hands, okay? All the nerves are affected. Peripheral vascular disease, blood vessels, okay? Blood vessels get congested, blood vessels get affected. They end up with vascular problem, okay? And all the rest will come, okay? Hyperlipid problems. Hyperlipid is cholesterol problems. Hypertension, blood pressure problems, okay? Atherosclerosis, this is when your blood vessel starts having a lot of blockage, okay? And finally, coronary artery disease. Coronary artery disease, this is a blood vessel in the heart. So from head to toe, all different types of complication, okay? Now this is that's why I say diabetes is known as the mother of all disease. You must control it properly. If not, from head to toe, you end up with all kind of complications.
所以我们来看糖尿病的并发症。糖尿病我们说是所有疾病之母所以它是会带来很多的并发症，其中有一些包括像视网膜病变就是它影响到你整个视力，所以糖尿病病人一不小心的话是会瞎掉的然后还有肾脏病变，有没有？你的肾小球破损了，还有你的这个就是神经网络受损，整个身上的这个神经开始病变，还有所谓的血管，全身的血管开始硬化，然后还有高血脂、高血压，包括动脉硬化、冠状动脉疾病等等等等，从头到脚各种各样的并发症。
Some people would have also heard, some people who are diabetic, sores cannot heal, gangrene. Okay, some of them will end up where limbs, especially the legs and all that, amputation. All that are the complications that is caused by nerve problem, vessel problems, all this neuropathy, peripheral vascular disease. Eventually, what happens is amputation. That means cut, especially the leg, all these kind of things. So all the different complications. That's why this must be managed properly.
所以糖尿病所产生的这种并发症会在我们全身各处造成很多的神经的病变就是神经末梢没有知觉各方面都是造成了很多的病变，甚至到最后的时候，有一些人还要严重的话还要截肢所以真的要非常小心。
Okay, so that is about diabetes. Okay, what we were looking at just now. So this is some of the diagrams, all the problem areas for diabetes and all that. We spoke about this just now. Okay, head to toe. This is what we are talking about. From head to toe, everywhere will have problems. So this is what we want to avoid.
所以你可以从这个图里面就可以看得到从头到脚，任何的器官都会因为糖尿病而造成损害所以要非常的小心。
Okay, so that is some information in terms of diabetes and all that. Okay, so now let's look at the next lifestyle disease. Okay, also primary disease. It is what is this? Hypertension. So what is hypertension? Hypertension has to do with high blood pressure. Okay, this is where the body loses its ability to manage blood pressure properly.
好，第二个我们要谈的就是高血压，就是身体的血压飙高 身体开始失去对于血压的控制。
Okay, so when you talk about high blood pressure, hypertension, okay, this is where sometimes you will see this number. Okay, high blood pressure is blood pressure reading of 140/90. Okay, so 140/90. That's what normally we will say in the medical term. Okay, or higher. When your blood pressure, either one number, not just the first number, okay, not just the second number, okay, if either one of your blood pressure numbers is already above this, that means you are already in a hypertension zone. Okay, both the numbers are important. Some people say that first number I'm higher, second number I'm lower, so I'm okay. No, okay, either one number, if it is above this, that means you are already in a high blood pressure zone.
什么是高血压呢？高血压我们有所谓的收缩压跟舒张压，就是所谓的上下这两个数字通常来说，只要达到190或140跟底下的90，我们就把它当成高血压，而且不是两个都要同时高其中一个只要达到140，底下的只要达到90，其中一个达到，我们就把这种情况当成是高血压了。
Okay, so what is blood pressure? Okay, blood pressure is basically measurement of force applied on the artery wall. Now, just to let you know that when you look at the blood vessels in the body, generally there are three types. One is your artery, okay. Second one is a vein. The third one is capillary. Three types, okay. Artery means taking blood from your heart to the body. Vein is blood coming back to the heart. Basically, that's what it means, okay. So, when we do a blood pressure measurement, we are basically most interested to know what is the pressure on the artery, okay. So, it is the pressure of blood that is acting on the artery walls, okay. So, this will tell us how much of pressure is being applied on the artery walls and to see whether if this pressure is within normal range.
OK， 那什么叫做高血压呢？基本上来说，我们就要讲到血管。血管基本上分3种，一种叫动脉，一种叫静脉，一种叫微血管。OK， 动脉呢就是我们的心脏，把这个血液输送到全身各处的这个主要的脉络，我们叫动脉。而静脉呢，就是当血液要重新回到心脏所走的那个脉络呢，叫做静脉。那血压呢，一般指的就是动脉里面血液对于血管壁的旁边所造成的测压力记得是动脉就是我们量测的是血压对于动脉所造成的这个压力。
Okay, and what is this? Your blood pressure is at its highest when the heart beats. There's two sequences that happens, okay? Now, basically, when you look at the blood pressure number, okay, like an example of what we saw just now, 140/90. Now, normal blood pressure is 120/80. That is normal blood pressure, okay? It is lower than 120/80. Now, the first number, when we look at the number 120, okay, so what is that number called? It's called systolic. Systolic is when the heart is pumping. Okay, that's when the pressure is higher. Okay, now when the heart is relaxed, that means the heart is not pumping, is the bottom number. It's called diastolic. Okay, diastolic is when the heart is at a relaxed state. Okay, so when the heart pumps, we call it systolic. This is the first number, 120. When the heart is in a relaxed state, we call it diastolic. That is the number, the lower number. Both numbers are important.
OK， 所以我们每一次讲的血压基本上分上下，就是所谓一个叫做收缩，一个叫做舒张。收缩的意思就是当你的心脏开始收缩，血液往外注射的时候呢，这个时候这个血液对于动脉血管所造成的压力呢，那个叫做收缩压。那第二个呢，就是底下的那个数字呢，就是当你的心脏开始没有收缩，就是舒张的时候呢，血液回到心脏，这个时候 对于血管壁所造成的那个压力呢，我们叫做舒张压，上下都是很重要的。
Okay, and what is normal blood pressure? Just like what I mentioned to you just now, a blood pressure reading below 120/80 is considered normal. Okay, so later we will look at a range of blood pressures.
OK， 所以一般来说120/80被认为是正常的。
Okay, now this is the table of blood pressure. You look at it. Okay, now this is the systolic. This is when the heart pumps. This is diastolic, when the heart is at rest. Okay, so normal blood pressure is when it is below 120, below 80. This is considered normal blood pressure. Okay, now pre-hypertension. Pre-hypertension means on the way to hypertension. This is warning zone. Okay, when the blood pressure, your systolic is between 120 to 139. When your diastolic is between 80 to 89. This is the warning zone. If your blood pressure is in this particular range, you have to do something about it to bring it back to this range. Okay, now the moment it crosses, okay, the 140 mark, from when your systolic is between 140 to 159, and when your diastolic is between 90 to 91, this medically we call it stage 1 hypertension. When it goes between 160 to 180, there's a typo error here, 160 to 180, okay, it is stage 2, okay, and when the systolic, diastolic is between 100 to 110, that is stage 2. The moment it goes above 180 or above 110 for the diastolic, this is called stage 3, and this is emergency malignant hypertension. Okay, this is where if we measure blood pressures that is above 180 systolic or above 110 diastolic, we must refer you straight to the hospital, because why? Now the risk of a stroke is very high. So this is very important. So most important to control it below 120/80, and if it reaches this particular zone of 120 to 139 for the systolic, 80 to 89 for the diastolic, you must do something about it to bring it down. If not, you will go into hypertension zone.
OK， 我们来看一下整个血压的一个标准。一般上来说，正常是收缩压在120以下，舒张压在80以下哈。那如果你到了这个120，就是收缩压在120到139之间的话，然后舒张压在80到89之间，我们讲说你这个叫前高血压，就是你已经在往高血压的路上去。那如果你的收缩压是在140到159，或是舒张压在90到99之间，我们称为你这个是第一期的高血压。如果是在160到180之间的收缩压，或是100以上到110之间的舒张压，我们讲你这个是第2期的高血压。如果你的收缩压去到了180或以上，然后舒张压高到110或以上的话，这个时候我们讲你是高血压第3级。这个时候如果你去看医生的话，你是要紧急入院的，因为你这个时候罹患所谓的中风的几率就变得非常非常高了。
Okay, so if you have any type of high blood pressure, okay, there will be certain tests that is done now. Okay, now these are some of the tests that is done, okay, as part of high blood pressure investigation. Okay, urine test is done, certain blood test is done, and sometimes also what we call ECG test to see the heart rhythm. Okay, so these are some of the common tests that is done for investigations.
所以一旦你有高血压的时候，基本上你会被测试的做的测试有这几种，一种就是尿液测试，第二个是血液测试，第三个就是心电图的测试。
Okay, now high blood pressure is called a silent killer. Why is it called a silent killer? More than 50% of the time got no symptom. Somebody will only know they have high blood pressure when they get a stroke. Okay, so more than 50% of the time people do not know that they have high blood pressure. So how to know what is your blood pressure? Cannot tick up. The only way you can know that you have high blood pressure is you have to use a machine to measure. Must measure. cannot aga and all that. Okay, so you must be sure by doing a measurement. Okay, and you must always measure your blood pressure. If you don't have problems with high blood pressure, at least measure once a week or at least measure once every 2 weeks. Very, very important.
好，我们讲高血压被称为无声杀手，因为50%以上的这些高血压患者实际上都没有任何的症状，所以你绝对不可以用猜测的方式哦，你一定要有个血压计来定期的检测你身体的血压是这样，是非常正常的。我都建议你至少每个星期做一次，或每2个星期测量一下你的这个血压。
Okay, so when taking a blood pressure reading, okay, now I know many of you all you have the digital blood pressure monitors and all this kind of thing is very good. Today it is very affordable. Every home must have a glucometer, must have a BP meter. Very important. Okay, but taking the reading, there's a few guidelines that you must follow. Okay. Don't run up and down the staircase, okay, and then immediately measure your blood pressure. Definitely your blood pressure is going to be high. Okay. One thing that is very important is this, okay. If you drink coffee within the last 30 minutes or you smoke cigarette and all these kind of things, if you take your blood pressure, you're going to notice that your blood pressure is higher than normal. Okay, because why? They are all stimulants. Okay, and the other thing is, do not take blood pressure when your bladder is full. If you feel like you want to urine, go and urine first. If your bladder is full and you take blood pressure, okay, your blood pressure will be higher than normal. Okay, and you must sit down and relax for about 5 minutes, okay, 5 to 10 minutes before you do the test. Sometimes I tell people, sit down, relax, take a few deep breathing, do some deep breathing and all that. Only then take your BP reading. You must follow this. If you follow this, then you're doing a correct measurement.
好，除了血糖计以外呢，血压计是另外一个我强烈建议大家一定要拥有的哈。当你要测血压计的时候，有一些标准你一定要能够符合，你才能够拿到一个准确的血压计。第一个，你一定是要坐住啊，放松的时候啊来做这个测试，或是躺着的时候来做这个测试。然后在这个测试前的30分钟，不要喝咖啡或是吸烟 ，OK？ 然后呢？记得要在测这个测试之前，记得去上厕所，不要整个这个膀胱都是很胀的哈，里面很多尿液的，这个时候很紧张的情况底下来做这个测试，然后在做测试之前先静坐5分钟啊，千万不要跑上跑下，突然坐下来测这个血压，然后我通常建议大家先能够做一个深呼吸，然后静下来了之后才来做这个血压的测试。
Okay, now categories of hypertension. Sometimes we give it different names and all that. Okay, the most common one, okay, that affects most people is known as essential hypertension. Essential hypertension is basically for most medical practitioners and all these kind of things, they might not be able to identify what is causing it. Okay, as you get older, many of them might tell you that it is normal for your blood pressure to go up, okay? But normally when the blood pressure starts going up, there's a reason why it goes up. And most of the time it's because of mismanaged lifestyle, okay? That's why I mentioned here, for essential hypertension, it tends to develop gradually over many years, okay? But we have people that, 30, 40, 50, 60, 70 years old, okay? All throughout your age, your blood pressure is stable, okay? So it is not about age, okay, it's about how you manage your lifestyle.
高血压的成因到底是什么呢？实际上到目前为止，并没有一个很明确的一个原因有一些人这一生当中，活到很老的，血压一直都是很稳定的，所以到目前为止，没有一个很明确的原因来告诉大家到底是什么原因造成高血压。
Okay, now, so the first one is essential hypertension. The second one is called secondary hypertension. This is the one that sometimes we must be very careful. That is the reason why I always tell, measure your blood pressure. Okay, try to do it once a week or once in every 2 weeks. Because if you notice that your blood pressure has been normal and then suddenly it starts to go up, suddenly it starts to get very high. Okay, now that is telling you that there is something that is causing it. That means that's why we say secondary hypertension. Okay, other problems might be causing your blood pressure to go up. Sometimes it could be related to a kidney problem, sometimes certain tumors, okay, or certain endocrine glands, okay, or it could even be problems with the heart, okay. Any one of these that is suddenly having problem can cause your blood pressure to suddenly go up. So it's very important, and that is called secondary hypertension.
而第二种高血压，我们叫做继发性高血压的成因是什么呢？它是突然出现的。这种突然出现的高血压，通常就是因为你的身体里面，譬如说你的肾脏开始受损了，然后身体出现肿瘤或是某一些先天性的一些心脏病开始恶化。这种情况底下也可能产生这个所谓的高血压。刚才讲的那一种，我们叫做essential 的高血压，就是不明原因的。这种叫继发性的高血压，突然出现了，它的原因呢，就是刚才我们所说的那一些。
Okay, and there's also some other reasons that can cause secondary hypertension. That means your blood pressure might be normal, suddenly it starts to get higher and higher. Okay, of course we talk about tumors just now. Okay, certain type of tumors. Okay, it could be benign or even cancerous tumors can cause it to go up, especially the adrenal gland. Okay, this is the gland that is on top of the kidney. Okay, sometimes alcohol poisoning. Somebody who drinks too much of alcohol, blood pressure can go haywire, can start going up because of poisoning of alcohol. Stress is another one that can suddenly cause blood pressure to go up. Today, this is very common. Okay, some people who take appetite suppressants, weight loss medication. Now, this one also a very, very big problem because there are many people that go buy medication from pharmacy and all that to lose weight, and their blood pressure goes haywire and can create a lot of problems with the kidney and liver. Okay, Heterosclerosis is basically when you get blockage in your blood vessel. When there's a blockage in the blood vessel or hardening of the blood vessel, okay, then you can also cause blood pressure to suddenly go up. Females who are taking birth control pills, OCP, oral contraceptive pills, okay, sometimes when they change the type of pill that they're taking, blood pressure can go up. That's why it's very important that if you're going to take OCPs and all these kind of things, okay, please check with your doctor because some of the birth control pills can cause blood pressure to get very high. Okay, drug use, cocaine use, and a lot of what we call recreational drugs or drugs that are taken, party drugs and all that can cause severe increase in blood pressure. Okay, and of course the other one, just now I mentioned to you, above-adate problems, diabetes and hypertension. If you become a diabetic, it's only a matter of time before hypertension will come. If you become a hypertension person, okay, it will be probably about time where you become a diabetic. So you have to be very careful of that.
还有这个继发性的高血压也可能是由于以下的原因第一个就是肾上腺的肿瘤肾上腺是一种腺体，它是在我们的肾脏之上的所以如果那边有了肿瘤就有可能影响我们的血压。那这种肿瘤它可能只是良性的肿瘤，不一定是癌细胞，它也可能造成血压的不正常。还有就是酒精中毒，过量酒精的使用，焦虑跟压力，控制食欲，就是有一些人为了要减肥去吃药，有没有吃药来控制食欲的这个就会造成高血压，甚至造成这个肾脏的受损。然后还有就是动脉硬化，有一些妇女吃避孕药也可能会造成血压的不正常。还有就是过度药物的使用一些 cocaine 这种一些药物，然后还有就是糖尿病，我们常讲嘛，糖尿病是万病之母嘛，所以如果你患上糖尿病，迟早你都一定会扯上高血压。
Okay, and some of the other causes of hypertension. Whenever you talk about high blood pressure or blood pressure, one of the main controls of blood pressure in the body is by the kidney. Your kidney is the organ that controls blood pressure. So when you start having problems with the kidney, that's when your blood pressure will go haywire. Okay? And when your blood pressure starts getting higher and higher, there's more and more damage that is happening to the kidney and the heart. Okay? So certain types of medication, okay, also can cause blood pressure to go up. Obesity is another one. And when you have a sudden pain, when somebody is in a sudden pain, blood pressure can also go up. Okay. Pregnancy can also cause blood pressure to go up, but then normally after delivery, the blood pressure will normalize back. But this is also a warning that later part of age, blood pressure problems might be there. Okay, renal artery stenosis. Okay, where we talk about blockages in the vessels in your kidney. Okay, can also cause blood pressure to actually go up.
好，我们来看其他高血压的成因，包括什么？包括肾脏疾病。我们要永远记得哈，我们的身体的血压主要的控制器官是肾脏哈。然后呢，有一些人因为头痛的关系，治疗头痛的这个偏头痛的这个药物也会造成高血压、肥胖，或是你有突然的疼痛，然后还有就是怀孕、妊娠期的时候形成高血压。同样的，如果过后正常，但是也表示在未来的日子里面，你罹患上高血压的几率是比较高的。然后最后就是肾动脉的狭窄也会造成高血压。
Okay, this one, the last one here, renal artery stenosis, it could be reaching a level of blockage or vessels, the artery in the kidney is becoming narrow. Narrow means it's becoming smaller and smaller, where there's already a problem of blood flow in the kidney. And when there's blood flow problems in the kidney, blood pressure can also be affected.
再强调一次，就是在肾脏里面的动脉一旦狭窄的时候呢，就会造成这个高血压的情况。
Okay, so some of the risk factors. Okay, for most people as they start getting older, okay, blood pressure probably can start increasing. But this is because of mismanaged lifestyle most of the time. Because they are having other problems, could be related to high blood pressure or cholesterol problems, circulation problems, and all these kind of things. Okay, so because of that, age can cause your risk to actually get higher. The other one is family history, genetics. Genetics can also run in families, okay, causing high blood pressure. But don't forget, okay, genetics will contribute to maybe about 20-25%. Only 75% is based on your lifestyle.
Okay. 然后呢，年龄有些人的高血压也会随着年龄而增加，不过大部分的情况都是这一些人的一些生活习惯还是有问题的。然后就是家族的历史高血压往往在有高血压的历史当中，就是所谓的遗传因素。可是我再一次强调，遗传因素大概只占25%到20%到25%之间。其他的75%还是主要是由你的生活习惯所造成的。
Okay, and then certain what we call there's also a risk factor on certain type of race. Okay, now what we have noticed is especially among the Africans, okay, and some Latins and all these kind of things. Okay, there's a higher risk of high blood pressure. But today, okay, the whole world globally, okay, because of cross in terms of cultures, in terms of food, okay, in terms of lifestyle and all these kind of things, okay, I would say that, okay, if you don't manage your lifestyle properly, regardless what race and so, okay, your risk for high blood pressure will go up.
当然种族方面也是会有一些影响的。高血压在黑人当中常常会见到，相对于白人而言的话呢，严重的并发症在黑人的族群里面也比较普遍像中风或心脏。不过像我所说的，就算你不是属于这个族群，可是因为你没有很好的这个生活习惯的话，高血压也是会找上你的。
Okay, some people ask me what is the fastest way to bring down blood pressure related to lifestyle. You know what I tell them? Start walking. Okay, if you start walking and you start increasing your walks every day, okay, and you start walking up to 10,000 steps a day, okay, within 2-3 weeks, you will notice that your blood pressure numbers will drop between 5 to 10 units, okay. That's why very important. Activity is very, very important, okay. And when you start walking, you start to improve your cardiorespiratory system. That means your circulation improves, your blood vessel become more flexible, okay, and you start to manage your weight properly. So many things about high blood pressure is related to how you manage your lifestyle. Okay, if you start walking, okay, start getting into an exercise program, okay, now your blood pressure not only will it be more stable, but it will remain stable for longer periods of time. Okay. Now another thing that can increase blood pressure is smoking of cigarettes. Okay, tobacco use. When you start smoking, okay, and all these certain chemicals within cigarettes, okay, and all these kind of things, okay, they can damage artery walls. When they damage artery walls, your blood vessel become hardened. When your blood vessel become hardened, your blood pressure becomes higher.
OK， 有人问我要怎么样在最快的时间里面解决我这个高血压的问题，我就会建议他赶快去运动，尤其是走路，每一天走1万步以上，2到3星期的时间，你就可以看得到你的血压就会有非常显著的这个进步了。然后第二个问题就是要控制你的体重啊，动脉壁的压力随着血管的血量增加而增加，因为你胖嘛，所以你的血更加的多，可是你的血管里面的体积照样是这么多的，所以这种情况底下压力当然会增加。然后第三个呢，就是减少烟，就是抽烟，因为抽烟会让你的损害你的动脉壁，让你的动脉壁变窄，变得比较硬。这种情况底下，当你的这个血管变得比较硬的时候，很自然的血流就会更加的困难，那血压就会相对的升高。
Okay, of course, too high consumption of sodium, okay, can also cause blood pressure to go up, okay, and the reason for that is when your sodium levels in the body is too high, okay, you have fluid retention. There will be too much of fluids in the bloodstream, and when there's too much of fluids in the bloodstream, okay, blood pressure can go up. Okay, now a bigger problem than sodium, okay, is actually when your potassium levels in the body is low. Okay, low potassium levels is a bigger contributor to high blood pressure. That is why your minerals are very, very important, because minerals and salts, they balance whatever that is in your fluids. Okay, they're called electrolytes. Okay, when your electrolytes are in balance, okay, blood pressure is in better control.
好，另外一个呢就是钠的摄入哈，如果你的钠身体里面的钠比较多的话，很自然的你的身体会产生更多的体液进入你的血管当中去冲淡这个钠的这个容量。想象一下啊，如果你今天的血管是固定的，可是里面的体液就是血液量增加的话，很自然的你的血压一定会上升的。那另外一个呢，当你的钠的含量增多了之后，就会造成钾的摄入的减少，所以很多高血压的人体内的钾是比较少的，所以这个就牵涉到我们的这个这个矿物质的吸收就变得非常非常的重要的，矿物质的平衡。
Some of the important nutrients to help manage blood pressure, okay, nutrients like omega-3, okay, nutrients like vitamin E, vitamin C, they are the antioxidants. Antioxidants will cause lesser free radical damage, okay, and they will increase the flexibility of your blood vessels. And among the minerals, that is one of the most important minerals for your vessels, allowing the vessel to be able to be flexible, that means to dilate. That means the vessel, your blood vessel can become smaller or bigger. Dilation means bigger, okay, is this particular mineral called magnesium. Magnesium is very, very important to help the body regulate blood pressure.
OK， 那营养素里面呢，很重要的营养素对于控制这个高血压很有用的呢，就是 Omega-3， 就是奥美加3，还有维他命 C、维他命 E 啊，然后尤其是这个维他命 C 可以让你的血管更加的有弹性。当你的血管更加有弹性的话，血压相对的就不会这么高。那另外一种矿物质对于扩张我们的血管是很有帮助的，就是我们的镁质啊 ，Magnesium 会很重要。OK。
The other problem that also causes an increase in blood pressure is when heavy drinking, alcohol, okay? Because excessive consumption of alcohol, and I use the word excessive consumption, if you take in moderation, okay, generally not much of an issue, but when you take too much and it becomes habitual, okay, it starts to damage the heart and it starts to make your blood vessels more rigid. And blood vessels, when it's rigid, means it's hardened. And when the blood vessels become hardened, it's very difficult to regulate blood pressure. And of course, stress. Okay, stress is one of the biggest contributors today to actually problems related to hypertension. Because why? Stress hormones. When the stress hormones get higher, your blood pressure will go up.
OK， 第二个接下来我们讲到的就是过量的饮酒。当你的酒精摄取过量的时候，会让你的血管硬化。当你的血管硬化的话呢，血压相对的就会变上升。然后接下来呢就是压力，今时今日压力造成很多的问题，因为压力会造成我们体内的这个皮质醇，就是所谓的压力荷尔蒙上升。当压力荷尔蒙一上升的时候呢，血压也会跟着上升。
Okay, so many people get high blood pressure as they get older, okay, and many people believe this is normal. It is not. The reason why the blood pressure is going up is because your blood vessels are getting to be hardened, okay, and they are no longer flexible. So when the blood vessels are no longer flexible, okay, your blood pressure is going up. So increased blood pressure is not part of healthy aging. You need to manage your blood pressure well. If not, you're going to start having effects on the heart and the kidneys.
所以很多人说，老化年纪大了就一定会得高血压，其实这是不对的。因为最重要的就是你一直要维持你的血管足够的弹性。那就算到了你年纪稍微大的时候，血压也不一定会相对的变得比较高的。
Okay, so what are some of the complications of high blood pressure, hypertension? Okay, one of the biggest complication is this one. Okay, it's basically stroke. Okay, stroke happens when blood vessels in the brain sometimes can burst. When a blood vessel bursts, you get a stroke. Okay, and it can damage the heart. Okay, it can damage the blood vessels. Okay, and kidney. Okay, so these are the common systems that get damaged because of high blood pressure, and we see this very often.
而这个高血压最常见到的这个所谓的这个并发症呢，就是我们讲的中风哈。中风它就是血管爆裂，这种血管爆裂它可以发生在我们的脑部，可以发生在我们的心脏，也可以发生在我们的肾脏。所以一旦发生在这些地方，都会相对的对心脏、对我们的脑部、对我们的肾脏造成极大的伤害。所以我们已经见过很多这样子的个案。
Okay, so you see what happens here? Normal, this is all normal. Okay, and then when high blood pressure, the brain is inflamed. Okay, you can see the brain is under stress. You see the kidney is starting to get damaged here. Okay, high blood pressure is damaging all the filters in the kidney. Look at the heart. This is a normal heart. Look at the chambers in the heart. Okay, big rooms in the heart. This is normal. But high blood pressure, the rooms are becoming smaller. The chambers are becoming smaller. The heart itself is now becoming bigger. Somebody with high blood pressure, enlarged heart. The heart is already enlarged. So all this is caused by high blood pressure.
OK， 所以大家你可以看得到哈，这个整个高血压对于我们这几个的器官造成的一个伤害啊。首先我们来看第一个脑部，你可以看得到，当我们左手边这一排都是正常的血压，这一排你看这个脑部已经是高度发炎的一种情况。然后当我们看我们的肾脏的时候，很多肾脏里面的肾小球就是过滤的那些小的那个过滤器都会爆裂，因为高血压的关系。然后你看这整个心脏，正常的心脏里面的心室、心房都是很大的，可是这个心室、心房都变小了，整个心脏反而变大了，整个心脏的那个肌肉都变厚了啊，这个就是高血压所造成的。
See up here in the brain, all this is bleeding, bleeding in the brain.
所以你可以看得到上面这些脑啊，其实这些红红的都是你的脑开始出血了，有吗？一点出血了。
And this is what will cause a stroke.
啊，这个就是会造成中风的情况。
Okay, so what is the objective? You must make sure that the blood pressure is below 140/90. This is to avoid going into a disease. Okay, But don't forget, best blood pressure is to keep it below 120/80.
OK， 所以我们目的就是要让我们的血压在140/90以下，当然最好的是在120/80啦。哦，所以目标就是要保持你的血压正常。
Okay, so some of the preventive steps, we spoke about this earlier. Healthy weight, be physically active. Okay, there's what is this? Eat balance. Okay, that means enough fruits, vegetables. Okay, keep your dairy to a very low level also. Okay, and less salt and sodium. Okay, make sure you have the other minerals. If you're smoking, this is a bigger problem. Okay, alcohol is another one. In moderation, okay, but smoking totally is very bad. Okay, so you need to manage back your lifestyle.
Okay, so 预防高血压的步骤，跟我们之前所谈的一样的，就是第一个，保持健康的体重，保持身体的活动，健康饮食计划，强调水果、蔬菜和低脂肪奶制品，选择和准备钠以盐少量的食物，然后戒烟，烟完全不要有哈，那适度的酒精 ，OK， 如果你有喝酒的话。
Okay, so the other one is some for especially high blood pressure and all this kind of thing. There are many individuals out there that sometimes they come and see me and then with the medicines, different types of medication given because of high blood pressure. And many of them tell me, I don't want to take medicine, but what else can I do? You cannot stop medication immediately, cannot. You must make lifestyle changes for your blood pressure to drop first. Once your blood pressure starts dropping, then we can reduce the medication. So it's very, very important. Don't if somebody comes and see me with a blood pressure of 180/100, okay, no need to talk about lifestyle. Straight away give medicine first. Because why? Have to bring down the blood pressure. If not, the person might get a stroke. Okay, so must remember this. Medication is to help control the symptom. Once the body is more balanced, you must emphasize on lifestyle changes, to actually help the cell to control it long term. Okay, medication can only help you to manage the symptom. If you do not manage your lifestyle, your blood pressure will continuously get higher and higher.
所以我常常跟大家建议的就是，药物啊，有些人血压高达180、110来见我的时候，讲说不要吃药，我跟他说不行，你一定要吃药，因为什么？当你高达180、110的时候，实际上你中风的风险是非常大的，所以我们一定要一面用药物来控制住，然后一面改变我们的生活习惯。当整个血压已经开始逐渐改善了之后，我们就可以减少我们药物的摄取。
The third line here, medicine will control your blood pressure, but they cannot cure it. Very important, This is very, very important. Can only help you to control, but cannot offer a cure.
所以很重要的，你一定要记得，就是药物将控制你的血压，但它不能够治愈它。
So how do you get back control of your blood pressure? Lifestyle. What is lifestyle? Proper nutrition, proper hydration. Hydration is drinking enough good clean water. Okay? Enough rest and sleep, physical activity, okay, and exercise. And number 5, manage your stress properly. These 5, magic 5. Okay, if you manage that properly, then you can get your blood pressure back under control.
好，所以基本上来说，我们讲还是要恢复你的那个生活的形态哈。我们讲第一个，你要有这个均衡的营养素的吸收；第二个要喝水啊，喝足够的水，然后要运动，然后要懂得处理你的压力。然后最终要有适量的运动，这5个魔术5招啊，帮助你很好的控制你的血压。
Okay, so there is another condition that can sometimes affect people who, as they get older and older. We call it isolated systolic hypertension. This one, the systolic is the first number. Only the first number start increasing higher and higher. The second number is normal. Okay, so the first number crosses 140 or above. Okay, this one normally affects people who are elderly. As they get older, okay, we call it isolated systolic hypertension. You know, now when we see this condition affecting a person, okay, this is already a condition that tells us that their blood vessel already is hardened, or they got blockage in the blood vessel, or sometimes their valve in the heart is affected sometimes. But most of the time, the blood vessel itself is hardened. We call it isolated systolic hypertension.
OK， 还有一种情况就是单纯的收缩高血压。什么叫单纯收缩高血压？就是它只有上面的那个数字特别高，底下的那个保持正常。我们通常看到这种情况是发生在60岁以上的人有这样子的一个情况。这种情况是为什么呢？通常都是他们的血管开始硬化所造成的一种现象。另外一种呢，很可能跟他们的心脏的瓣膜有关系，那个瓣膜不正常的操作所造成的。
Okay, so that is some information in regards to what is this high blood pressure. Okay, I know there's a lot of details there and all this kind of thing, but as long as you can understand the fundamentals, that is good. Okay, now there's another condition that I did not talk about in the lecture. It is not just about high blood pressure, but some people suffer from a condition called low blood pressure. Okay, not many, but there's a small percentage of people that suffer from low blood pressure. Most of the time, females. Okay, females that are going through their menstruation cycles and all these kind of things. Okay, so sometimes their pressure can drop. Okay, now first thing is low blood pressure is when your blood pressure is below 90/60. When your blood pressure is below 90/60, then it's considered low blood pressure. Okay, and most of the time, the cause of low blood pressure could be related to anemia. Anemia means basically sometimes in bahasa Malaysia say kurang darah, less of hemoglobin. Okay, anemic, less of iron in the body. When there's not enough iron in circulation, okay, low hemoglobin, that can cause your blood pressure to be lower. Okay, these are the common conditions that actually causes low blood pressure, anemia. Okay, now of course, you know, when somebody suffers from low blood pressure, investigations need to be done. Okay, most of the time by doing a blood test, we can find out, okay, what is causing it and all that. Okay, sometimes, okay, for most serious case, it could be a problem with the heart. Okay, when there's a problem with the heart, sometimes blood pressure can also be low. When there's a problem with the kidney, can also cause this problem. Imbalance of chemical reactions in the body. So there are many possibilities that can also cause low blood pressure. Okay, but the problem is lesser than high blood pressure. So if somebody has problems with low blood pressure, okay, investigation needs to be done to find out what is actually causing it.
Okay, 好，我要再讲到一个情况，就是比较少发生，但是有的就是所谓的相对于高血压，它是低血压的。通常这种低血压主要发生在女性身上，尤其是月事期间的这个女性哦。然后呢，通常我们讲这个低血压，就是讲收缩压低于90，舒张压低于60，很多种情况底下，他们有伴随贫血的问题，缺血红素、缺铁哦。所以当然还有什么可能其他的原因，就是心脏的问题、肾脏的问题。整个体内的这些化学元素的一种失衡所会造成的这个低血压哦。那如果要知道真正是什么原因呢，就必须要经过进一步的检测才能够断定。
Okay, so that is the lesson for today. Okay, so we will stop here at high blood pressure. Your next class will be on Friday, right?
Yeah.
Okay. So on Friday, basically we'll be looking at problems related to hyperlipidemia, which is basically problems related to cholesterol. We will be looking at heart attacks. We will be looking at stroke and cancer. Okay, that is for Friday. Okay, Now, before we leave today, I will also address some questions first. You just give them a briefing first.
OK， 我们今天的课程到这里暂告一个段落。然后星期五的话，我们会谈到高血脂症高血脂症、心脏病，还有甚至癌症，我们会提到这些所以接下来我们会针对某一些问题来进行回答。
Okay, let me just address a few questions here. Okay, these are some of the questions that were put in the group chat. There is a question that asks in regards to stem cells, and this is interesting now because stem cell therapy is getting more and more popular. Okay, first of all, we need to remember that stem cells are produced in our bone marrow. When we are young, the production of stem cells, is high. As we get older, the production of stem cells become lower and lower. Okay, if you have a lifestyle disease, then the production of stem cells become even lower. What is stem cells? Stem cells are mother cells. Stem cells are very important to help anywhere in the body. Okay, so there are some people today that will ask this question: can I go for stem cell therapy? Okay, yes, there are some centers out there that is offering stem cell therapy, not cheap. Can cost you up to 100,000 ringgit a year. Okay, so many of them do stem cell therapy for anti-aging purpose and all that, But let me give you also some realistic numbers. Okay, probably 80% of people who go for stem cell therapy, it doesn't work for them. You know why? Because there's too much of inflammation and free radical problems in the body. Stem cells are mother cells. But stem cells are very fragile. Fragile means they are very weak. If your body has high inflammation and if your body has high free radical oxidative stress, the chances of stem cell working for you will be very low. A lot of the stem cells will get destroyed in the body. So those of you who are considering stem cell therapy, it's more important to get the body in balance first. Once the body is in better balance, then stem cell therapy is more workable for you. Today they are doing a lot of investigations using stem cells to help people who are diabetics, people who are having joint problems, people with problems with the brain cells, Alzheimer's, even Parkinson's and all that. A lot of investigation. In the next 10, 15, 20 years, we're going to see a lot more research, that is coming in to actually help people who are suffering from other conditions. So this is a little bit about stem cell therapy. It's still available in the country, but it's more important for you to focus on other lifestyle interventions that can be giving you better results at the moment. And it can also give you more long-term support. Stem cell therapy normally is advisable for people who are actually above the age of 60 or 70 years old.
好，有人问到关于这个干细胞治疗方法到底有没有效什么是干细胞？干细胞是我们身体的母细胞，它是由我们的骨髓所产生的那现在有坊间很流行这个干细胞的这个治疗，这种治疗不便宜可能有一些1年的花费大概要超过马币10万块以上。但是我可以很坦白的告诉你80%的这种治疗到最终都是以失败收场的。为什么呢？因为干细胞是我们身体的母细胞，可是通常接受这些治疗的人身上的这个发炎都太高了的。它虽然是母细胞，可是它是非常脆弱的，所以在这种身体里面，当它被注射进去或是用口服的方式的话呢，进到一个高发炎的身体里面，通常它都没有办法生存长久。所以这种情况底下，这个所谓的干细胞治疗方法对这些人来说帮助并不大。所以我的建议是，如果你要做这种治疗的话，首先你要把你的身体的发炎指数降到最低，当你的整个身体处于一种平衡的状态底下的话，才去做治疗。目前有很多研究针对糖尿病帕金斯症这些做这种的治疗，以后会越来越多。不过一切东西都要回归基本，你一定要把身体的弄成平衡了之后，干细胞才会对你的身体产生作用。
Okay, now stem cell therapy is actually taking stem cells, there are different types of therapy. Sometimes you have donor stem cells, sometimes it's your own stem cell that we take and filter in the lab and then increase the numbers and put it back into you and all that. There's so many different types, okay? But there is also another category of stem cells through supplementation, okay? There are certain supplements in the market that basically will start to stimulate the body to produce more stem cells, okay? Some of y'all that want more information on this, I would suggest that you go and study what we call the blue-green algae. Blue-green algae is a type of algae family that comes from the ocean, okay? It's kind of seafood, okay? That is why sometimes even seaweed, taking seaweed frequently actually increases the production of stem cells. You know, seaweed is actually a anti-aging food, but make sure you get good quality seaweed. If not, got too much of contamination in seaweed, also problem, okay? So it's a blue-green algae. These are stimulant. They are not stem cell, but they stimulate your own body to produce more stem cells. Okay. Now the other one is having enough sleep is very important. You have enough sleep, your body produces more stem cells. Okay. And exercise. Exercise promotes stem cell production. And of course, there are other nutrients. One of the nutrients that is very important is also proteins. Proteins, amino acids. Okay, helps the body produce sufficient stem cells.
Okay. 好，所以呢，其实这种所谓的干细胞的治疗方法有很多种，有一些是利用本身自己的干细胞取出来之后加以培养，让它的数量增加了之后再注射进去，有一些是别人捐赠的健康的干细胞注射进这个患者的体内，无论哪一种方式都好啦。包括像有一些我觉得可以通过一些保健品。你可以做得到的，像一些藻类，蓝色的藻或是绿色的藻，都可以增加我们体内的这个干细胞的成长。然后还有一种海藻，但是你要确定你吃的这个海藻是健康的、干净的，否则你会对你的身体带来更多的这个重金属啊。然后除此之外，充足的睡眠，这个充足的运动都可以帮我们的身体增加这个干细胞的产生，然后更重要的一个就是你要摄取足量的蛋白质，才能够帮助你的身体产生足够跟好的这一个干细胞。
Okay, now that is the first question. Of course, must remember, stem cell on its own is a big topic and lecture on its own. I speak about stem cell, sometimes it's half day, 1 day just on stem cell alone.
所以这个干细胞是一个很大的主题，有时候我单单讲课讲干细胞要讲半天到1天的时间哦。
Okay, the second question that I want to address is a very interesting question because normally I get this question from people who are very familiar with certain nutrients and all this. You know, the question is in regards to is it okay to take omega-3 together with calcium, magnesium? Okay, now this is a very interesting question because for people who study nutrition in detail and all these kind of things, okay, you will notice that, you know, sometimes they might not advise you to take magnesium together with omega-3. Okay, now, is it true? Yes, it's true, but here we're talking about high dosage of magnesium and high dosage of omega-3 because why? Both of it will make the blood vessel actually become dilated. Dilated means blood vessel become larger. Okay, so if you take too much, your blood vessels can become too big and your blood pressure can drop. Okay, now that is a consequence. But then the amount of magnesium found in normal supplements, the day-to-day supplements, and also in omega-3, the EPA, DHA levels of normal omega-3 supplements, okay? Now, if you take within recommended dose, including up to 5 times more than the recommended dose, it should not interfere. Okay, it will not interfere. But if you take very high dosages, then there's a possibility of blood pressure dropping. Okay, have I seen this before? Yes, I've seen it before, but very rare. Okay, so normally we use high dosage magnesium as a therapy, not normal supplementation. It's under the category of nutritional therapy. nutritional supplement and nutritional therapy is two different things. Nutritional therapy is when we are very targeted to use nutrients for specific disease. That's when the dosages are is normally much higher. Okay, the purity is much higher and the controls are much tighter. Okay, but for normal supplementation where you take a combination of calcium, magnesium, vitamin D together with omega-3, if you are taking within the normal dosages that are recommended, generally it should not create any problems.
OK， 我这里要提到一个问题哦，通常一般人不会问这样的问题哦，可是这个问题蛮有趣的，我在这边跟大家解释的，就是有人问是否吃这个奥美加3跟镁两个加在一起是会有问题的，答案是，但是它必须在很高的剂量底下才会产生问题。为什么？因为奥美加3跟镁质两个都会让我们的血管扩张，所以如果你是在很高的剂量同时吃奥美加3跟镁质一起的话，有一个可能性就是你的血管过度扩张了之后，你的血压会造成所谓低血压的问题。可是，一般现在市场上的这些保健品，包括像 Nutrilite 这样的保健品，如果你吃了建议量的5到6倍，都没办法产生这种现象。可是如果你是真的很高的那种剂量的话，是有可能发生的。那所以我要在这里跟大家强调，所谓的营养品就是保健品的supplement， 就是所谓的辅食一般吃的方法，跟营养品治疗的方法，这两种是完全不同的概念。如果我们用保健品来作为治疗的话呢，那个剂量是非常大的。可是这种剂量呢，不但它是非常大，而且要非常的就是经过非常安全的一种控制底下，我们才能够进行这种情况。可是普通的一般现象，大家不用担心。这个奥美加3跟镁质是可以同时服用的，而这种情况是很少发生的。
Okay, now the other question was in regards with low blood pressure that we spoke about just now during the lecture on hypertension. Okay, but I just want to remind that low blood pressure is when the pressure is below 90/60. Okay, and some of the main the reasons that causes that, okay, is when the person is anemic. Anemic means basically the levels of hemoglobin in the body could be low, iron could be low. This is one of the main causes of low blood pressure. But it could also be caused by other more complicated problems with the heart, okay, hormonal problems, kidney problems. All these can also cause the blood pressure to actually drop. Even disease, COVID-19 now, as the person is actually becoming more and more infected by the virus, okay, the coronavirus, blood pressure starts to drop because why? The lung is slowly starting to fail. So there are many other even infections can cause it. So when somebody has this problem, proper investigations need to be done.
好，另外一个问题就是刚才我已经有提到的所谓的低血压的问题。一般上来说，低血压，我们讲的就是收缩压低于90，舒张压低于60的这种情况，它可能是所谓的普通的一般贫血所造成的，就是你的血红素不够，你的铁质缺乏这样的一个情况。当然，它也有可能是心脏的问题、荷尔蒙的问题、肾脏的问题这种情况所产生的啊。所以不过要特别就是这几种情况所产生的 ，OK。
Okay, and the last question that I will address tonight is somebody asked the question about omega-3 oil. If the person is a vegetarian and cannot take fish oil, what are the other options? Okay, now, of course, there are many vegetarians out there. If you can't take fish oil, then the other options that you can get omega-3 is from plant source. Plant source omega-3, one of the most famous source is from flaxseed. Okay, flaxseed oil, okay, or you should take the flaxseed itself. Now when you go You can get flaxseed quite easily. Flaxseed is Flax, flaxseed, okay? And this flaxseed will come in brown color, golden color, okay? There are two types, okay? Both are very good, okay? And flaxseed is not just good for omega source, but flaxseed is also very good for digestion, okay? And it doesn't cost much. It's very easy to get in the health food shops, okay? That is one good source, okay? The second source of omega-3 from plant source is from chia seed, okay? Chia seed is also a very good source of omega-3, okay? Then most nuts and seeds, you know, when you talk about walnuts, when you talk about almonds, you know, all the nuts and seeds also have omega-3 levels in them, okay? So you can combine all these different nuts and seeds and the chia seed, flax seed and all that, and take that, and that will give you what they call good levels of omega-3. But the amount that you take is also important. If you take too little, okay, normally if you don't take omega-3 capsules, when you talk about flaxseed, I always will advise them to take 1 teaspoon twice a day. Chew in the mouth, crush it. They must crush it. When you take the flaxseed, okay, make sure you crush it, okay? If you're going to crush it, you can use a crusher to crush it, immediately consume it. If you put it in your mouth, make sure you chew it thoroughly, okay? But chia seed is different. Chia seed, even if you mix it water and drink, the body can absorb it, okay? But flaxseed, you must chew it thoroughly, okay? So these are some of the options for vegetarians. If the vegetarian can take eggs, okay, then kampung eggs is another very good source for omega-3, okay? Kampung eggs, not the farm eggs. The farm eggs and all that, omega-3 levels are low, but kampung eggs have got very high level of omega-3, okay? 5 times above the normal egg.
OK， 还有一个问题就是有人问关于如果吃素的人不能够吃那个鱼油怎么办？那他只能够从这个植物性的奥美加3来获取。那什么植物会有很高的这个奥美加3呢？就是第一个就是我们叫做 Flaxseed 奇亚Flaxseed 叫做 Flaxseed 一下子忘记了，有谁知道的？不是，奇亚籽是 Chia Seed。OK， 先这样子讲 ，Flaxseed Flaxseed 有2种，一种是褐色的，一种是金色的，两种都很好 ，OK。然后除了 Omega 3很高以外，它也里面的这个纤维也很高，所以对于消化是非常有帮助的。第2种呢，你就可以吃 Chia Seed，Chia Seed 是奇亚籽，比较小，所以你吃这2种有什么差别呢？Flaxseed 因为比较大颗，所以你一定要是研磨碎了之后才能够吃哦。然后或是你在嘴巴里面一定要咬到很，我建议大家不用咬了，我咬过了，没有很难咬到全部碎的啦。所以你还是研磨呢会比较好一点哦。然后或是那些nut就是所谓的一般的那些种子类的东西啊。还有一些坚果类的也是很高的 omega-3 ，OK。然后如果它可以吃蛋的话，我们建议吃所谓的土蛋、干崩蛋 ，OK。干崩不要吃那种农场蛋啊，干崩蛋的含量就是 omega 的含量是普通一般的那种农场蛋的5倍以上的 ，OK。这个是很好的这个 omega-3 的这个来源 ，OK。
Okay, so I think that's it for tonight. We have already gone through so many things and all that. I hope all of you all have learned something. Okay, you can also, I think Everest will upload the video. Maybe tomorrow you can have a look at it again, go through it, and I will see you all again on Friday. Okay, we will complete the section on diseases and all that. Okay, and I wish you all a pleasant night. Okay, and what is this? Have a good night. Have a good night's sleep. Okay, tomorrow go through the notes again with the videos and all that. And those of you all who have more questions, you can put it in the group chat. I will try to address more questions on Friday. Okay, so good night to all of you all. Hope you all have learned something. Okay, take care.
OK， 谢谢大家哦。我们希望大家今天都学到很多。然后呢，我们会在过后马上把这个 video 上载上去，所以大家可以在里面再去重新的这个复习这个东西。好，那我们今天的课程就到这里为止。刚才那个 Flaxseed 叫亚麻籽 ，OK， 谢谢大家的提供 ，OK。So thanks for all your time. Thank you, doctor. Thank you.
Okay. Good night, everybody. Good night.
Okay, everyone. Good night. Okay, bye bye.